Hi, everyone. I'm Dr. Shin Young Yim. Today, I am going to tell you about the medical treatment of cervical dystonia. Cervical dystonia is a painful condition in which the neck muscles contract involuntarily, causing the head to twist or turn to one side. Cervical dystonia can also cause your head to uncontrollably tilt forward or backward. In video number 149, I talked about the symptoms and causes of cervical dystonia. In terms of treatment of cervical dystonia, there are non-surgical medical treatments, surgical treatments for cervical dystonia along with physical therapy. This time, I am going to tell you about non-surgical medical treatment for cervical dystonia. There is no cure with the current medication for cervical dystonia. Medical treatment is aimed at alleviating symptoms of cervical dystonia. It is just like antihypertensive drugs or sugar-lowering drugs do for hypertension and diabetes mellitus. For oral medication, one of the most commonly used medicines in cervical dystonia is trihexin, which is a cholinergic agent. Dosage starts in 1 to 2 mg per day and can be gradually increased. Side effects include drowsiness, dry mouth, and confusion. Clonazepam, called Rivotril in the brand name, is also used for cervical dystonia. Side effect includes drowsiness. You can use a muscle relaxant, baclofen. These drugs are used together or alone. These pictures show trihexin, Rivotril, and baclofen, respectively. Depression, anxiety, sleep disorder, or pain in the neck and shoulder are common in cervical dystonia. When symptoms are severe to affect daily function, treatment is required. Let's talk about injections for cervical dystonia. Botulinum toxin is a neurotoxin produced by the bacterium Clostridium botulinum. It is a schematic diagram for botulinum toxin. Deep blue shows a light chain, and the rest represents a heavy chain. For muscle contraction, the muscle cells receive signals from the nerve cells. The nerves and muscles are separated by the synaptic cleft like this. The neurotransmitter acetylcholine is secreted from the nerve terminals and binds muscle cells. Then muscles contract. In cervical dystonia, unwanted, involuntary muscle contraction occurs, causing abnormal posture of the head and neck. For the neurotransmitter acetylcholine to release, several proteins called snare proteins need to interact with acetylcholine vesicles. Botulinum toxin breaks down the snare proteins that are involved in the secretion of acetylcholine. Then muscle contraction cannot occur. Therefore, this helps with abnormal contraction of cervical dystonia. Botulinum toxin treatment for cervical dystonia was first reported in 1985. After that, many researchers reported the therapeutic effects of the botulinum toxin. In 2000, botulinum toxin was approved for the treatment of cervical dystonia in the USA. The success rate of botulinum toxin is about 70%. The average duration of botulinum toxin is about 12 weeks. Around 3 months after injection, the botulinum toxin is no longer left in our body. The symptoms of cervical dystonia can recur. In most cases, repeat injections may be required at 3 to 6 months intervals. There are 4 types of botulinum toxin. The most commonly used botulinum toxin is Botox, produced in USA. There is a botulinum toxin called Dysport that is being produced in Europe. The botulinum toxin called Xeomin does not contain extra protein necessary to make the drug. In the United States, botulinum toxin type B is produced under the name of Myobloc. Botox, Dysport, and Xeomin are all botulinum toxin A. Myobloc is botulinum toxin B. Botulinum toxins work at the neuromuscular junction. By breaking down those proteins, the neurotransmitter acetylcholine is not released. It prevents muscles from contracting, which we don't want in cervical dystonia. The light chain of botulinum toxin A breaks down SNAP25 protein. The light chain of botulinum toxin B breaks down synaptobrevin protein. Accurate selection of involved muscles in cervical dystonia and injection with ample dose determine the effectiveness of botulinum toxin treatment. Swallowing difficulty, dysphagia, may occur temporarily when botulinum toxin spreads to the esophagus. These side effects such as dysphagia and weakness are temporary, and they improve. It takes about a week after injection to take the effect of botulinum toxin. The effect lasts about 3 to 4 months. Botulinum toxin injection for cervical dystonia has a better effect when injected in the earlier stage of the disease. The muscles to be injected are selected according to the head and neck posture. Let's talk about the most commonly injected muscles such as the sternocleidomastoid muscle, splenius capitis muscle, upper trapezius muscle, and levator scapulae muscle. Unilateral contraction of the sternocleidomastoid muscle causes the head and neck to contralaterally and tilt ipsilaterally. Therefore, if the sternocleidomastoid muscle causes cervical dystonia, botulinum toxin is injected into this muscle. These show splenius capitis and splenius cervicis, respectively. These muscles can cause ipsilateral lateralis and ipsilateral head and neck rotation. This shows the levator scapulae muscle, which elevates the scapular and bends the neck toward the shoulder. These are small muscles that are located deep in the head and neck. Obliquus capitis superior muscle makes the head extended. Obliquus capitis inferior muscle causes the head to rotate and extend. This slide also shows scalene muscles which make the head and neck bend toward the shoulder. The trapezius muscle is one of the muscles that are injected with botulinum toxin for cervical dystonia. A positron emission tomography is a diagnostic method to determine which muscle is causing cervical dystonia in each patient. In this patient, the muscles that appear black caused cervical dystonia. Botulinum toxin is selectively injected into these muscles. This patient shows several muscles with black signals on the PET study. That means these muscles are responsible for cervical dystonia in this patient. The botulinum toxin was selectively injected in these muscles. When injecting, an ultrasound-guided injection can be performed to selectively inject only the desired muscle while avoiding the surrounding blood vessels or nerves. You can accurately inject with electromyographic monitoring. Depending on the experience and preference of the medical doctors, each method can be used. Swallowing problem is the most common side effect of botulinum toxin injection for cervical dystonia. Muscle weakness around the neck, neck pain, dry mouth, and hoarseness also occur as side effects. On repeated injection, the dose and selection of muscle may be adjusted according to the response to the initial injection. Along with botulinum toxin injection, physical therapy for muscle and surrounding tissue can be helpful. Today, I talked about the medical treatment of cervical dystonia, the medicines, and the botulinum toxin injection. Thanks for watching this video. Next time, I am going to tell you about the surgical treatment of cervical dystonia, such as deep brain stimulation and selective peripheral denervation. See you next time.